start, I want to thank you so much for coming to Ekeronyo Sub-County Hospital, where this morning we received a distress call from Ikonge. The over secondary school at Ikonge PAG Girls. With quite a number of students who presented to our hospital with similar symptoms. I'm very proud of my sub-county team, very proud of them indeed. Sometimes unajua lazima ushukuru watu wako kwa kazi mzuri. They rushed into action very fast. The students the stabilization started, and as I'm talking to you, we have seen approximately 120 students. We have sent a team to school to confirm exactly what the problem is. The students are presenting with low abdominal pain, diarrhea, vomiting. It's a similar presentation across. We've taken their stool and sent it for culture. We have probably three to five who have not stabilized yet, and we've agreed that we are sending them to Nyamira for further review. But the rest we have agreed as a team that we are going to hold them here so that we wait for the culture results. Once the culture results are out, then we will know what basically we are treating and what medication we shall give. But for the meantime, we have done, my team has done stabilization. They have given prophylactic medication, and I'm happy that as you walk through the rooms, wanafunzi ambao walikuja who are so distressed, right now they are stable, and good work is ongoing. So kudos to the team at Ekeronyo Sub-County Hospital and Ekeronyo Nyamira North Sub-County for the good work that they've done, led by Dr. Matimo, who is the Sub-County MOH. And I'm happy that our Chief Officer Medical Services, Daktari Mwenyewe, was here very early in the morning to also see how things are ongoing. So far, that is what has happened. Stability is ongoing, and the first team of public health officers have rushed to the school, and we're also joining them to see exactly what the problem is. So right now, I can't say where the problem is, but what we think should be is something related to what they ate or what they drank. It's around there. So we have to first know where the problem is. It has never happened in Nyamira. This is the first time that is happening in Nyamira. So early last month, we had a very comprehensive discussion and meeting with the public health officers who are manning sub-counties or wards which are close to where schools are. And we identified our schools and graded them. We have graded schools as high volume schools, which we know have challenges. And others, of course, we have graded them based on the numbers of the students. So any school with 500 students and above, we graded them as high volume schools, which we've been keenly monitoring. And so that is why you've not had really a big problem in Nyamira, because we've been monitoring them. Our public health officers have been visiting the schools. We've been giving them guidelines on what they should do, and we've been working very closely with the school administration and the sub-county and the county education team. And I can tell you the situation is well monitored. That is why you've not had any serious issue from Nyamira. This one of Ikonge must be an isolated case, which before the end of the day, we shall give a brief about it.